And with that, so.
Good morning, everybody. I am so excited that you're here to join us today because our two guest speakers are probably the people that know the most about school nursing in our country during this COVID-19, and we are so blessed to have them with us today. I also want to congratulate all of you on being school nurses. As you know, yesterday was National School Nurse Day, and in the state of Vermont, our governor had declared it Vermont School Nurse Day. And that was really very much appreciated. If you watched the governor's press conference yesterday, you also heard Dr. Levine call out his gratitude for nurses before he started talking about the update in Vermont. We also received congratulations from the Vermont Superintendents Association, the National Education Association leadership here in Vermont, the Agency of Education here in Vermont, and of course, I hope you have all tuned in to Lori Combs' greeting to us nationally and internationally. Also yesterday, Clayton, Becca, Kelly, and I had an opportunity to talk about the wonderful work that you all are doing with VPIRG. It was pretty exciting to be able to do that on National School Nurse Day as well. So if you haven't had a chance to see that, you can find all of this and much more on the VSSNA.org website. We have two amazing speakers with us today. Lori Combe is our current president, and I'm going to share a quote with you. She said the COVID-19 pandemic has emphasized the essential school nurse role. Whether we're physically present in our health office or working virtually to support our students, the role of school nurse in public health, in policy development, in care coordination, and education is essential. A professional school nurse is needed in every school because school nursing is the foundation for student physical and mental health. And I'd like to share a quote from Donna. Donna says, in this global year of the nurse, it is an honor to recognize our nation's school nurses as we celebrate National School Nurse Day and National Nurse Month. School nurses influence wellness and disease prevention practices in our communities now more than ever during these changing times. It is such a privilege to have these two ladies with us and leading the charge for school nurses through this pandemic. I want to invite you all to send questions to COVID-19@vssna.org. And those will be addressed over time. Sometimes the most questions come up after we end our conversations. I know that always seems to be the way for me. So make sure that you send those questions to us and we will do our best to get the answers out as soon as possible. I'm going to turn it over to Becca.
So just a few housekeeping notes. As our speakers are presenting, please type your questions into the chat box. Those questions will be copy and pasted into our agenda document. And then when our presenters are finished, so we'll ask those questions from the chat box first. Once we've gone through, if we have enough time to go through all of the questions from the chat box, we will open a Q&A dialogue, and please use the raised hand feature, which can be found if you click on the bottom of your screen on participants. You will see a list of participants, and at the bottom of that list will say raised hand. And you can raise your hand and we'll know you have a question. So without further ado, I'm going to turn this over to Clayton Wetzel for an introduction of our speakers.
Thanks, Becca. I'm sorry, did somebody say something? Okay, so I am very excited to introduce Lori and Donna to everybody. And I'm really pleased that I'm able to work with them at the national level on the National Association of School Nurses Board. So Lori Colm, who's the NASN president, earned her BSN and master's in nursing from LSU Medical Center and is a nationally certified school nurse. Lori currently works as an independent school nurse and school health consultant, providing professional development and resource discovery for school nurses, school nurse leaders, and school communities. Prior to this, Lori worked for Klein ISD for 25 years in Texas. She served as the health services coordinator for 13 years, managing healthcare for 50,000 plus students in 49 schools, staffed with a full-time RN in each school, which is just amazing, and 2 counts, 1 a full-time nurse and 2 having 50,000 students in 1 school district. In her first 12 years at Klein, Lori served as a school nurse on the intermediate and high school campuses. And then in other nursing experience prior to school nursing includes adolescent mental health, home health and hospice, and nursing education. And a little personal note, Lori also told me after I accidentally sent her a recipe for sourdough bread that her boys and her husband both actually cook sourdough bread all the time. And I was supposed to be sending her a document signed by one of the nurses on our board and send her that recipe instead. So I will eventually send her a loaf of sourdough bread to acknowledge that. And Donna Mazyck is the executive director for the National Association of School Nurses. Donna earned her BSN from the University of Pennsylvania and a Master's of Science degree in counseling from Loyola University in Maryland, and is nationally certified in both school nursing and counseling. She is also a certified association executive. This credential is a marker of a committed association professional who has demonstrated a wide range of knowledge essential to manage an association in today's challenging environment. And the environment could not be more challenging than what we're seeing right now with COVID. And it's great that Donna holds that certification because that's really helping our overall organization. Donna was both NASN past director and an NASN past president from 2007 to 2009, and she began working at NASN in 2011. For 25 years, Donna practice focused has been in school health, starting her school health career as a high school nurse, and she worked for 13 years as a state school nurse consultant in the Maryland State Department of Education. Donna is also a licensed clinical professional counselor. She enjoys facilitating student well-being and success and connecting all the helpers, schools, students, families, agencies, and communities whose focus is on student health, safety, and learning. And my share about my relationship with Donna is as soon as I actually went to my first time to be on the board, she came up to me and said, "Hey, you should volunteer to do more stuff." And I told her that I was in the Navy and that stood for never again volunteer yourself, but I have the tendency to continue to volunteer more and more. But welcome, Lori and Donna. We really appreciate you being here. We're very excited to hear what you have to say from the national level and from international level. And with that, I'll turn it over to Lori.
Great. Thank you, Clayton. First, I want to say I'm a native New Orleanian, but moved to Texas about 30 years ago. And a school district of 50,000 is considered a mid-sized school district right here in Texas. You know what they say. I had a fresh loaf of sourdough delivered to the counter last night just before I went to bed. So I appreciate all 4 of my sourdough bakers. I'm going to share my screen now. And I'll try it. There it is, I think. Here we go. All right, get that out of the way. So I want to say that I am so grateful for this opportunity to meet with you today. This has been an amazing time. I've been president for almost a year, and I would have occasional interaction with members through the all-member forum. But since COVID-19 has arrived on the scene, I can't tell you what a joy it has been to have more and more interaction with individual members and to be invited to affiliate meetings just like this. It's been an exciting time for me, invigorating, really charging my batteries. You might see yourself on the screen. Clayton shared some screenshots with me. And you might see some of these again in the NASN school nurse issue for July, but this is really just a representation of what school nurses are doing during this pandemic to support communities. School nurses supporting one another, connecting through Zoom. You know, we work in isolation. And is this a new paradigm for us to stay connected, share ideas? I hope that Zoom doesn't go away from affiliate and school district connections. I think it's a tool that we've witnessed can really grow our community. Working from home, supporting student health, making sure kids and families have the food they need and that it's distributed safely, making sure their meds are at home, instructional material distribution. School districts are really looking to you to guide them in the best way to keep communities safe. They know you're essential. And School Nurse Day, I've seen lots of great posts from school districts, more than I feel like I've ever seen before, because the COVID-19 pandemic has driven home that school nurses are the experts, that they lead school health. And I hope that we don't lose that message. And I think that we'll have to continue to be proactive in delivering the evidence to school communities and garnering and keeping that seat at the table. So a day late, but still the same week, I want to wish all of you a happy School Nurse Day, School Nurse Week, happy Nurses Month, and to know that I so appreciate your support of students in crisis. I understand that you all have been looking at these coronavirus resources over the course of your meetings, and I want you to know that while this is posted to the NASN website, that it is school nurses who informed this work very early on, all the way back to January 24th. School nurses were talking about COVID-19 in the all-member forum, and that activity began to grow exponentially as this coronavirus reached the shores of the United States. And so as I try to read through the all-member forum every day, and the staff does the same, and it became clear to us that we needed to be collecting the questions asked and curating the resources shared. And so that School Nurse Net community has really developed this. So thank you to all of you for your feedback into that forum and for the feedback we have received from affiliate organizations. And I want to give a big shout out here to Sharon Lee Truffrey, my board colleague from just a few years back, who so graciously brings NASN to the table to collaborate on these documents. It makes our work richer, and I think it does clearly, as Clayton says, helps us to see where are our points of collaboration, how we can coordinate our efforts so we're not overlapping each other. I'm going to skip around a little bit here on my bullets. I want to tell you that since this virus came to visit us, that media outreach to NASN has increased exponentially. We are doing several interviews almost every week. I believe so quoted from one of them, I'm not sure. But the media want to know how school nurses are supporting their school communities. You heard that in my message to you yesterday. So we hope to continue to amplify that message, to exert the leverage and influence that we currently have to extend our advocacy efforts for the work you're doing directly in your school communities. I want to give a huge shout out to the NASN staff who worked to build this coronavirus page. They're updating it weekly. I noticed that the return to school guidance was updated just yesterday on School Nurse Day. I've been working with Liz Clark, who's a former board member and now NASN staff, to get those return to school documents built and on the website. In addition to that, the staff has pivoted our conference to virtual, and we'll talk about that in a minute. But they're also doing many other things, not just COVID. And if Donna will come on just for a second and let you know the other things that are in development.
Good morning, everyone. It is so wonderful to see you and to celebrate you. That's part of what Lori and I are doing today. We appreciate you. We appreciate your child health expertise and how it's been really on blast in terms of publicly, and really applauding the numbers of groups in your state who recognized you yesterday. So really good to be here. As far as what the staff is doing, one of the things that we understood right away is that we needed to communicate with our members, with school nurses more broadly, and to also make sure that that communication remained bi-directional. We're very fortunate that we have the School Nurse Net community all-member forum, because we get to hear from you, and what you share is what we listen to, and we make changes and we do things because of that. I will say that with COVID, one of the very important additions to our website was a live chat. We started that in March, and we now, it's kind of difficult to always be live, but we make sure that we get questions and we respond to our members. It's very important that we hear from you, because what school nurses have shared has been the basis for what we've developed. We do, right now, the way we work on the staff is to implement the NASN strategic plan as developed by the board of directors. So right now we're still doing that work, and online learning is one of the features of our work. You can imagine we're doubling down on that online learning. We're also focusing on the framework for 21st century school nursing practice. You will see several articles in the upcoming NASN School Nurse, the July issue, that really help us to dive deeper in that framework. It'll really help us pivot in the work that we're doing. We're also doing advocacy. We're continuing with data, school health data projects. We're still working on your behalf in the midst of what's going on with COVID. Lori?
Thank you, Donna. One other question we've had about the return to school guidance. is whether we are collaborating with CDC to develop their guidance.
Good question. NASN depends on the CDC to inform what we do in our work. And we have very close relationships with the school health branch and the Division of Adolescent and School Health. So very early on with COVID-19, as a matter of fact, the executive committee met in Atlanta, Georgia, and we had a visit scheduled with the CDC to discuss some of the issues going on with COVID. So we have a very strong relationship. When it was very clear that we needed to inform, that is the school nurse community, needed to inform about re-entry to schools and face-to-face, we reached out to the CDC with an outline of what we had planned. We offered our assistance, and we of course shared with them what we had. In the meantime, as Lori mentioned, NASN last Thursday was able to, with the help of NASN and other groups, and Sharon Lee, it's good to see you today, we were able to develop this guidance that you see now on the NASN website. I sent that guidance to our colleagues in the CDC, who both of them from the areas that I mentioned were on the CDC COVID task force team. They have since rotated off of that team, but they were very grateful for the information that we have. What I understand as of today is CDC does have guidance on re-entry to schools. It has not been completely vetted to post publicly at this time.
Donna, thank you for that update. I think that, you know, the lessons that we learn here first as an organization is that the situation is rapidly changing. And so we have to be flexible, and we need to have a plan to update our guidance on a regular basis. I have concern for school nurses who have communicated with me that they are not being invited to the table to work on re-entry plans. And you and I know what that looks like. Somebody else develops a plan, and then they expect you to carry out a plan that perhaps is not based on evidence, that doesn't take into account all of the precautions one must take to prevent the transmission of disease in the school community. Things such as isolating suspected cases, managing aerosolized procedures, all those things that create risk. So if you don't have a seat at the table, I hope that you will use the templated letter on this coronavirus disease resource page that is targeted to school administrators, and see if you can use it to get yourself a seat at the table. Sometimes you just need to invite yourself to the table, but in doing so, you have to be prepared to offer the evidence and the resources once you arrive. So I'll be anxious to hear from you if you have concerns about that, either right here in the Q&A session at the end of this presentation, or you can always email me at lcomb@nasn.org. I do want to let you know that I spoke with the director from Montana. They have brought all of their staff back to school. They have a very low burden of disease in Montana. And so as most states are doing. They are taking a stepwise approach to reentry, and the students will return to school on Monday with social distancing and staggered arrivals and other measures to make sure that they're not spreading disease. So it will be important for us to watch what happens in these states where schools are reopening and to understand what the lessons are from those situations. I think the good news is that state school board organizations are utilizing NASN reentry guidelines in their guidance. If you go to the Missouri School Board Organization, you will see that the NASN documents are linked within that document. So that's promising to us. We did collaborate on some of our original guidance with the National School Boards Association, and we think that that is a very valuable partnership for us to have, and we think it's an essential partnership for you to have within your state. So I hope that you are reaching out to those groups. I want to talk a little bit about the virtual conference. You can see that there are two options. The virtual NASN 2020 has 15 CNEs. Oh, and you can see I have a typo there. It's not a CME for every poster you view. So you'll still be able to visit posters. And I always love the poster sessions because there's so much good information there. And then there's the NASN 2020 Plus, which gives you access to 8 additional CNE. All of the CNE will be available for 90 days after the conference. So if you can't visit during June 30th through July 3rd, but you're registered for conference, you can access that after the fact. If you're already registered for conference, you should have received an email. If you haven't, then you can be in touch with conference at nasn.org. But you have several options. You can transition your registration to a virtual format. The virtual format is less expensive than the in-person conference, so you can donate the balance to the endowment fund. I'll talk about that in a second. Or you can ask for a refund, or you can ask for a full refund. So I hope that you will consider joining us for this virtual conference. We've done some live streaming before, so we have some experience. What's going to be different is we're going to have a virtual annual meeting, and that annual meeting will actually be open to all members, whether they are registered or not, up to whatever capacity our platform can offer. I think Donna's still investigating that. We're going to have a separate awards ceremony where we'll honor School Nurses of the Year. I might be wrong about that. I'm going to retract that. I think we'll have a little PowerPoint showing that, but we will award, let me think, we'll award scholarship winners and research grant winners there. At the annual meeting, we'll induct members as fellows of the National Association of School Nurses. And we're going to have a virtual exhibit hall. I can't wait to see how that works. If you've ever been to conference, the exhibit hall is such an exciting and vibrant place to be. Those exhibitors really create this great sense of community and fun and engagement. And we have a passport, and if you visit all the vendors on your passport, you turn in your passport card, and then NASN draws out a card for free registration for the next year's conference. And the same thing will happen this year, only virtually. I do want to talk to you a little bit about the endowment. I noticed Rebecca had last year's conference scarf on from Denver. Today I'm wearing the conference scarf for the 2020 conference. We purchased them before we knew we weren't going to be meeting in person. And those are going to be on sale, and all funds go to support the endowment, which of course funds school nursing research and education scholarships to advance your education. And I have a challenge that's the President's Double Down on Data Challenge this year. It's the year 2020. It's Florence Nightingale's 200th birthday. She was a champion of data. So I'm asking you to donate $2, $20, $200, the change from your purse, whatever you can, to support school nursing research. Because when I talk to the media, they want to know, what is the data that says we should have a school nurse in every school? So we really need to develop that data so I can tell them with great authority just what that means. If you've heard about the petition to fund 10,000 school nurses, I hope you have signed on. NASN is asking the White House to provide funding to support 10,000 nurses for underserved communities across this nation. You may be familiar with the Nurse Act, and so we're trying to amplify that message. I want to tell you our first goal was 5,000. We exceeded that in less than 48 hours. Yesterday, we were over 12,000 signatures. We've extended the deadline to May 11th at 11:59 p.m. So I'm encouraging you to go to this banner that you will see on the NASN website and to lend your advocacy to this effort to tap into some of this pandemic emergency funding to support student health and the increased needs we know those students will have when schools reopen. If you know anything about me, you know one of the values that I hold dear is gratitude. And this statement is so true for me that when you look for those moments of gratitude in each day, you find joy. It creates joy in your life. And so even when we go through these difficult times, there's always some little thing that we can be grateful for. One of the writers I read from amazes me because she finds joy in the rainbow in the soap bubbles in her sink. So that's really looking for tiny moments of gratitude, isn't it? I'm grateful for you and grateful for this opportunity to be with you today. So if you have questions, Donna and I look forward to finding the answers for you.
Thank you, Lori. So thank you, and I'm going to then share my screen. And so Soph is going to take over the reading of the questions for Lori and Donna. And bear with me for a second as I get to that section. And then we will be typing the answers into this, which will be shared out, and that'll be posted as quickly as possible. Any answers, any questions that are asked that we don't have immediate answers to, we will get with Lori and Donna or the NASN staff or whomever and get those, and we'll post those after the fact as quickly as possible. So Soph, go ahead, and then I'll work on sharing my screen.
Thank you, Clayton. Donna, did you have anything else that you wanted to share before we get to questions and answers?
No, thanks, Soph. I'm looking forward to interacting with those questions and answers.
Okay, great. So the first question is, what recommendations do you have to those of us that are over the age of 60 and even over 65 regarding returning to work, school, in August, if that's, or whenever school's open?
That's an interesting question. My youngest son actually is working in the Netherlands, and their guidance is for age 70. So, you know, where does that lead? I think that what I would be concerned with is if you have any health conditions that would put you at risk. I think each person needs to make that assessment based on their particular situation. If you do decide to go back to work, what access would you have to appropriate personal protective equipment to protect your health? And then what accommodations can your employer make for you? I think that's a discussion to have with your school district and your healthcare provider.
Yes, I appreciate that, Lori, and I would add to that this is where it's so vital for the school nursing voice to be in the reentry plans. And as I look at reentry, we're really looking at reactivating a space. So what's involved with that? That has to be considered well before the doors open. We have to look at respecting health and wellness. As we know, it's every individual, every person has to be considered in terms of existing health conditions that could make them more vulnerable. That's from the youngest person in the building to whatever the age is of the oldest person. It's really looking at those vulnerabilities, and that has to be respected. And also in revitalizing the property and the workplace operations, all of that is part of it. And so I would actually frame that question as a must answer in this planning time right now for school districts.
And I would say it won't be just the school nurse that has that concern. So you're so right, Donna.
Thank you. The next couple of questions are all related to temperatures and thermometers. So I'm going to read all three of them before I give you a chance to answer. The first question starts out, what temperature monitoring technology is recommended when we return to school? Particular nurse's superintendent wants him or her to be looking at walk-through thermoscanners. Are there any specific thermometers that are being recommended? Is there something that's more accurate than another? Who is expected to do the screenings? And question or comment related to using infrared thermometers and their inaccuracy as they are appearing to be sensitive to the environment, not so much the individual.
So I've had this question several times, actually from a reporter. And so I went to our trusty textbook See? And if you have the latest edition of School Nursing, the Comprehensive Text, you can refer to page 214 and 15. But here's what the summary table says. So there are recommendations for normal temperature and febrile temperature. And the electronic oral thermometer has good evidence and quality in both normal and febrile. Tympanics are not recommended. Temporal artery scans have good evidence and quality for both normal and febrile. The temporal infrared scan is not recommended. The chemical dot is not recommended. And the axillary has low quality in normal temperature and is not recommended for febrile patients. And what's interesting about the infrared scan, when you read about it, as it underestimates febrile conditions. So what this says to me is that the electronic oral is our best bet now, or the temporal artery scan. How do we keep those sanitized, right? And how do you, I mean, I've heard of schools that want to take everyone's temperature. It's not feasible. First of all, you don't have enough thermometers, and I'm guessing maybe you won't be able to get enough thermometers to do that. So can we have individuals self-check? Well, can we rely on the self-check? I think these are hard questions to answer. I do want to say that this evidence I just read to you is from two sources, one in 2014, one in 2015. I have seen news articles where that infrared camera is identifying people. I do not know the evidence related to that, and I think that we need more research in that area. Will that happen before schools reopen in force? I'm not sure.
Thank you. I'm sure this is going to be a question that many of us will be continuing to seek answers to, and I appreciate that. I also appreciate you directing us to that fabulous reference book that you brought out. If you don't have it yet in your office, put that on your order form. So our next question, is there any information on the states receiving funds to hire more school nurses?
I have not heard about states providing more funds to hire more school nurses. What I have heard is concern that due to the downturn in the economy related to the quarantine, that state revenues are down, therefore school budgets will be down, and that is of great concern.
And I'll add to that, the one jurisdiction where there were school nurses added was New York City. It was not in response to COVID, it was in response to legislation, or council legislation, and it happened to dovetail with the timing. I'm not sure what they're doing with that because, of course, New York City was hit pretty hard with cases of COVID, and so I'm not sure that they were able to move on that hiring.
It'll be interesting to find out how that affects us
Yeah.
in the future. I think we all need to stay on top of that. Here's one that I know you both are going to have some amazing information for. Do you have advice about how to advocate for more school nurses in districts where one nurse is responsible for multiple schools, or also in our state where people are part-time, even in multiple schools?
I think the answer is in the data. So I had a conversation with a colleague just this week, and she was faced with an interim superintendent who was going to replace a nurse with unlicensed personnel. And she came to the table with data that described the number of students in that school who had chronic health conditions and the number of school nurse interventions related to those students with chronic health conditions, plus the number of school nurse interventions necessary to maintain the normal population in the classroom, including medications, time spent developing individualized health plans, time spent doing state-mandated screening and the numbers of screenings. And the interim superintendent turned to her and said, well, we have to have a school nurse in that school, right? So I think that your best story is one that is supported by data. I mean, data, administrators love data, right? And then you need those stories that maintains student confidentiality, but the stories that drive the data home. And if you're traveling campus to campus, how many clock hours are you spending in your car not delivering services? And what does that cost the school district in relationship to your salary? Is that good use of school district funding, of public money, or private money if you're in a private school? So I think that if you'll go to NASN's data page, there's some training there, how to use your data, and this might be a good way that VSSNA could support members to help give some exemplars from people around the state who have used data successfully.
Thank you for that. So much appreciated. And we are doing all that we can at this point. The more of us that speak up in our local district level, as well as those of us at the executive board level, we are continuing to advocate for you, the school nurse. And I've kind of taken my cue from Lori and Donna when I talk with people in the at the top of our agencies that we need a school nurse full-time in every school, regardless of the number of students right now, because of this COVID situation that is continuing to unfold. We'll see what happens with that. Donna and Lori, the next question relates to some information about what people are seeing with children manifesting signs or symptoms or not of COVID. Yesterday, the Vermont Health Department meeting said that health providers have noted in research that kids do not spread coronavirus even when they're positive in the nares, and people don't understand why. There have been only a few kids tested in Vermont that have been positive, but usually they are children of a positive adult. And what can you share with us about that? Also relating to the signs and symptoms that are so much, appear to be so much milder in children than adults.
I think that we really won't know that whole story till we bring children together, is what I suspect. I think that more testing is needed, and I'm sure that you've heard that in your state and nationally as well, to understand exactly what is the burden of disease within our communities. Because I think maybe the data right now is skewed, right? I've read that children are showing signs of other illnesses, Kawasaki's disease, for instance, but that evidence isn't very clear that it's directly related. So I just think that we need more information, and unfortunately, we're probably going to discover it as we bring kids back together. And we might find that exactly what you've just said is true, or we might find the opposite is true.
Mm-hmm. And I think within that question is an answer, and it's staying close with the information that comes from the Vermont State Department of Health. I think, and with Sharon Lee Treffry in your ranks and able to provide some real-time feedback, I think that will be how you will find out how to proceed around children in COVID.
Thank you. Here's another question related to temperatures. Why do we keep talking about temperatures when it's a 1 to 3 day late and definitely $1 short is the quote in terms of time and money, and it's not necessarily useful information? The statement then goes on, the nurse hopes most of us would assess signs and symptoms and include other data, which would include temperatures for any student for any reason every day, COVID or not. How do you respond to the focus on temperatures?
I think that we utilize temperature because it's in the CDC case definition, right? And so if I'm reporting to the health department, what do they want to know? They want to know, does it meet the case definition of this illness? I think the question is absolutely, or comment is absolutely correct, that you're also looking at the entire picture. So when I refer to people conducting a self-check, that's a review of symptoms. One of my colleagues here in Texas, they have employees coming in and out of buildings for essential functions, and they created a Google form with a QR code access, and that employee uses their QR reader, they complete the survey, and it tells them whether they're admitted to the building or not, and that they're not taking a temperature at the door. They're assessing for those other symptoms, and they're reporting if they have fever. So might that be viable for staff? I don't know how you manage that for a student body, particularly considering the wide age range, right? So it's a bit of a conundrum at this point.
Thank you. Another question about temperature. What is the temperature cutoff going to be? Is that going to change? Also, when would you recommend the screening to take place of the children? Would it be before they get onto the school bus as opposed to when they get off the school bus at the school?
Well, now that would be interesting. I think about the school district where I last worked and how many school buses we would have to staff to make that happen. But you're so right, because that congregate setting first thing in the morning. Are we going to physically distance children on buses? My historical perspective is that transportation is the most costly line item on a school district budget. Probably not. So it's a good point before they get on the bus. Again, do schools have capacity to screen the temperature and symptoms of every child who walks through the door? I mean, we have high schools with almost 4,000 students. Elementary schools with 1,200 students. How do you do that? I mean, what time does class start? Right? So I think that those are local decisions that will have to be made. I'll tell you that the temperature cutoff, I checked it just this week on the CDC website, is still 100.4. I remember during H1N1 that was moved to flat 100 degrees Fahrenheit. So I don't know what the guidance will be for schools in that regard, but currently it is status quo.
Thank you. We have reached 10:29. All the questions have not been answered, but I want to thank you, Lori and Donna, for being here with us. Those of you listening in can continue to send your questions and we will get them answered as quickly as we can. Today's town hall meeting will be posted on our VSSNA.org website, most likely by the end of the day. As you know, we continue to post the minutes that we take during this time, as well as Q&A that comes up. Please check your emails because the invitations for the town hall meetings go out early in the week. So keep an eye on your mailbox. Difficult to find that invitation if you're getting hundreds of emails during the time frame. So flag it somehow so that you'll be able to find it easily when it comes up, so that we can see you all here next week, Thursday. Please, if you're not members, join. That can easily be done at vssna.org. You've just had the pleasure of hearing from two very experienced school nurses, women who are very much advocating for you and your role in the schools, as well as school nurses all across the state.
I don't know if we just lost Soph. Anyway, I'm sorry, Soph, go ahead. You locked up for a second.
Sorry.
Okay, I just wanted to mention, so Donna, Lori, thank you very much. At one point we had 178 folks on, which is the largest we've ever had. So that was really great. I think technology wise that things worked really well. I was so excited that Lori was able to take control of the screen and make it work. So that was awesome. And we will get this up very quickly. And we just want to say thank you. And thank you to everybody for coming in and asking amazingly, just really, really good on-point questions. It's really helping all of us to learn more about what's happening with this and how we can all work with one voice to moving forward and learning together and speaking together to do that. So thank you so much. And we look forward to seeing everyone. Do you have, so Lori, Donna, anything else before we sign off?
I would like to thank you all for letting me join your meeting today. And as I mentioned, I think this is a good way for affiliates and national leadership to stay connected in the future.
Yes.
Yeah.
We're learning new ways, and you're part of creating that. Thank you for giving us your time today. Thank you.
Thanks so much.
Thank you.
Okay. So everybody, thank you. I'm actually just going to stop the recording.